Medical communication for the fourth semester of the Faculty of Medicine includes 1. More specific material. A. Communication with special patients. 1. Children. Communication strategy. Using simple language that is appropriate for the child's age. Storytelling techniques or using visual aids such as pictures or dolls to explain medical procedures. Reducing fear. Involving parents to provide a sense of security to the child. Providing non-threatening explanations, for example, calling a syringe a small tool that helps the body. 2. Elderly. Communication barriers. Difficulty hearing or understanding information due to age. Fear or anxiety related to diagnosis. Communication techniques. Speak slowly and clearly. Repeat information if necessary. Use communication aids if the patient has hearing loss. 3. Patients with chronic, terminal illnesses. Breaking bad news. Spikes. Setting. Perception. Invitation. Knowledge. Emotions. Strategy. Technique to deliver bad news systematically. Communication approach. Provide emotional support and prioritize empathy. Focus on palliative care options if needed. B. Cross-cultural communication. 1. Cultural understanding. The importance of understanding the patient's cultural norms, such as taboos about certain illnesses or traditional healing rituals. Example: in some cultures, cancer is considered something that should not be discussed openly. 2. Multicultural communication techniques. Use an interpreter if there are language barriers. Avoid assumptions or stereotypes based on the patient's race, religion, or gender. Ask politely about cultural preferences in medical care. C. Ethical aspects in communication. 1. Patient confidentiality. Case example: keeping HIV patient medical information from being known to third parties without permission. How to convey medical results to patients in a closed room to maintain privacy. 2. Principle of autonomy. Providing complete information to patients so they can make their own medical decisions. Respecting patient decisions, even if they are contrary to medical advice, e.g., refusing a particular procedure. 3. Informed consent. A technique for explaining the risks and benefits of a medical procedure clearly before the patient gives consent. 2. Direct practice. A. Role play and case simulation. 1. Communication practice. Simulate giving a diagnosis of a serious illness to a patient. Practice communicating with an angry or upset patient's family. 2. Diverse scenarios. Dealing with patients with high anxiety. Communicating with patients who have communication limitations, e.g., deaf patients. B. Practice in the clinical environment. 1. Medical interview. A questioning technique to obtain a patient's medical history effectively without making them feel interrogated. 2. Observation in the hospital. Observing direct doctor-patient interactions and analyzing the communication methods used. 3. Feedback and reflection. Group discussion after practice to evaluate and improve communication skills. 3. Interdisciplinary approach. A. Psychology and medical communication. 1. Recognizing patient emotions. Techniques for reading body language, gestures, facial expressions, to recognize anxiety or discomfort. 2. Managing conflict. Dealing with aggressive patients or patient families while remaining calm and professional. 3. Empathy and rapport. How to build good relationships with patients to increase their trust and openness. B. Public health. 1. Public education. Strategies for conveying health information to people with varying levels of education and understanding. Example: creating a campaign about the dangers of smoking using simple language and attractive visuals. 2. Collaboration with the community. Working with community leaders to convey health messages that are relevant to local cultural values. C. Hospital management. 1. Medical team. Effective briefing techniques for communicating medical information between team members, e.g., in surgery. How to handle conflict between medical professionals on the team. 2. Communication with patient's family. Communicating the patient's condition honestly and clearly, including in critical situations. Addressing difficult family questions while maintaining calm. Additional learning support tools. 1. Simulation video. See examples of good and bad doctor-patient communication for learning. 2. Case study. Analyze a real case where poor medical communication led to misunderstanding or malpractice. 3. Self-evaluation. Students are asked to record their communication practices for review and evaluation.